Hi, I'm Dr. Reslet. So, in this set of videos, I'll be explaining an important topic from chapter 1 of CPT textbook, that is evaluation and management. Okay, so in this video, I'm explaining how to take codes, how to take codes from MDM table of evaluation and management chapter. Okay, the whole chapter will not be explained this video. Only how to pick code from the MDM table is explained in this session. Explaining the MDM table, first I will give you an idea about this evaluation and management concept with an example. Okay, so a patient came to a physician. The patient is having fever. So the patient's chief complaint is that he is having fever for last 2 days or 3 days. Okay, then the physician will take history of presenting illness or HOPI. Okay, he will ask a series of questions like when did the fever start? Did you take any medication for fever? Does the fever aggravates at night? Or do you have cough or cold with the fever? Like that, he will ask a series of questions in order to take the history of the presenting illness. Then the physician will ask about the personal history of the patient, that is if the patient is having any other systemic illness, like if the patient is having sugar or hypertension, like that. Okay, then the physician will ask if the patient's parents have any systemic diseases. Okay, after all that, the physician will give investigation procedures, which means he may order for some tests, some blood test, or if the patient comes with an urine infection, means he will go for a urine analysis, or if the patient comes with a fracture, mean he will send for an x-ray, like that. All the x-ray imaging studies, lab test, etc. will be ordered, and after that, based on the patient's problems as well as the results of this test and imaging studies, the physician will finally reach in a diagnosis, and the physician will decide what treatment he should give. Okay, so the whole procedures which I have explained so far is called the evaluation and management. If you look at the codes for this evaluation and management chapter in your textbook, you can see it is there divided into different sections like outpatient, then hospital admission, inpatient, then emergency department, consultation. Like that, different categories are there. I'm not explaining each category here, but you can see in each section. For example, in outpatient, you have straightforward, low level, moderate level, high level. Okay, in every section you will be getting codes like this. Okay, these are called the level of evaluation and management. Okay, so until 2023, there were three elements or factors which depend the evaluation and management comes under which level. They were history, examination, as well as medical decision making or MDM. Okay, but from 2023 update, history and the examination part is of having no importance. Currently, the level of evaluation and management depends only based on the level of medical decision making. Okay, so in our CPC examination, we will get questions where the MDM or medical decision making will be given directly in the question. In that case, it is very easy and clear to take the level of E&M from the question. Okay, but in some questions, now the pattern is in majority of questions from 2023, in the majority of questions, they will not directly give the level of medical decision making or MDM. Instead, we have to find from the question that this particular question comes under which level of MDM or medical decision making, and after that we have to decide it comes under which level of evaluation and management. Okay, so in order to identify the level of MDM which is not directly given in the question, you have to Find out it from the table 1, which is given in the evaluation and management chapter, levels of medical decision making. One big table is there. From there you have to identify that this particular question have which level of medical decision making or MDM. So in these videos, I'll be explaining that table, that big table in detail, and all the elements of that table and all individual contents of that table. And finally, I will give you some 20 practice questions, and I will give you the explanation of that practice questions, how to take code from that questions. Okay. So before moving on to that big table which is given in the textbook, let me first give an idea about the small table which I have added. I have already told you there are 4 levels of MDM. To identify it comes under which level of evaluation and management. Okay, so the 4 levels of MDM are straightforward, low complexity, moderate complexity, as well as high complexity. Then we have 3 elements of medical decision making which decide that this particular question comes under which level of MDM. These 3 elements of MDM are: first one is number of diagnosis or management option, second one is amount and or complexity of data to be reviewed, third one is risk of complications and or morbidity or mortality. The headings which is given in this particular table. Okay. So I will tell you what these elements means. The first one, number of diagnosis or management options, means you have to look for what all are the problems that is explained by the patient and what all are the problems that is identified by the physician, what is the diagnosis. Based on all that, we need to identify in which category this number of diagnosis or management option come. That is whether it is minimal or limited or multiple or extensive. Okay, so we can call it as problem table because all the problems are considered in this section. Now the second element, amount and or complexity of data to be reviewed. It includes what all are the investigation procedures that is ordered by the physician, or if the physician have reviewed any test result which is already ordered by another physician, or if this particular patient is having an independent historian, or if the physician have discussed the treatment option with another physician. Such things come under this second element, amount and or complexity of data to be reviewed. You may not understand now, but I will explain each element in detail in the coming videos. Okay. Then the third one is risk of complications and or morbidity or mortality. So based on the problems and the data table, the physician will finally conclude with the management option. That is whether to give prescription medicine or whether to decide for a minor surgery or a major surgery or decision for hospitalization. All such things come under this third element. Okay, so we have to identify that and we need to look at the big table and we need to find out if it comes under minimal or low or moderate or high. Okay, so when you get a question from this type where MDM is not straightly given, first we have to identify the problems. Second, we have to identify the investigation procedures ordered, reviewed, etc. Finally, we have to identify the treatment option that is taken. Okay, then we need to look all these 3 comes under which one. That is, in problem table, it is minimal, limited, multiple or extensive. In data table, it is minimal, limited, moderate or extensive. In risk table, it is minimal, low, moderate or high. That we have to find out. Okay. How to find out that I will explain in the coming video. Don't be worried. Okay. Now after finding out that how to identify the level of MDM, it is like, if I will explain with an example. If in the problem table we got limited, if in the data table we got limited, if in the risk table we got low, means our level of MDM will be low complexity because all 3 are limited, limited, low. Okay. Similarly, if the problem table it is extensive, data table extensive, risk table high, means all 3 are extensive, extensive, high, means it goes to high complexity level of MDM. Okay. So the criteria is at least two among the three should be in the same complexity in order to take that particular complexity. Okay, for example, the problem table have multiple, data table have moderate, risk table have low means we can consider it as moderate. Okay, because problem table and data table satisfy with the moderate complexity. Okay, similarly, if the data table is limited and risk table is low and the problem table is multiple means we can consider it as low complexity, because data table and risk table satisfies with the low complexity. Okay, so if all the three are same means go to the same level of MDM. If two is same means you can take that particular level of MDM. Okay, what if all three are different? For example, if problem table is minimal, data table is limited, risk table is moderate means you have to consider the intermediate level, which means minimal, limited, moderate, the intermediate level is limited, right? Similarly, an example where the problem table is extensive, then data table is limited, risk table is moderate means we have to consider moderate complexity, because extensive, moderate, limited. So the in between complexity is moderate, right? So you have to take moderate complexity. So if all three are same means you can take that particular complexity. If two are same means also you can take that particular complexity. If three are different means you can take the intermediate level of complexity. First you have to identify, understand this concept. Okay, and from the next video I will explain you the big table which is given in the textbook, and I will explain each elements like the problem table, data table, risk table one by one. I will be explaining in the next video.